What if your bathroom knew more about your health than your doctor? Not in the future, right now. The next wave of healthcare isn't happening in hospitals or clinics. It's quietly moving into your home. And once you see what's coming, you'll never look at your bathroom the same way again. Think about this. You use your bathroom every day, multiple times a day. That makes it the perfect place to monitor your health continuously, passively, without effort. Instead of a doctor seeing you once a year, your home can track you every single day. And that changes everything. This shift didn't happen by accident. Three things finally lined up: AI that can spot patterns humans miss, sensors that are cheap, tiny, and insanely accurate, and people who are tired of waiting weeks for appointments and results. Healthcare is moving from reactive to predictive, and homes are the new front line. Let's talk about the most unexpected medical device in your home: the toilet. Every time you use it, your body is giving off valuable health data: urine composition, hydration levels, metabolic waste, even early signs of infection. Traditionally, this information only gets checked if you're already sick and go to a lab. AI-powered toilets flip that completely. These systems use sensors and computer vision to analyze urine automatically, tracking changes over time instead of one-off results. That means they can spot trends, slow shifts that indicate kidney issues, dehydration, UTIs, or hormonal changes long before symptoms show up. And the key advantage? Consistency. Your doctor might see you once a year. Your toilet sees you every day. This kind of passive monitoring turns healthcare from reactive to preventive without adding effort to your life. Now imagine if your mirror could do more than show your reflection. Smart mirrors use high-resolution cameras, and AI models trained to detect subtle changes in your face, things humans can't reliably notice. Slight shifts in skin tone can signal circulation issues. Changes around the eyes may indicate fatigue, anemia, or metabolic stress. Even tiny asymmetries can point to neurological or cardiovascular problems. Over time, the mirror builds a baseline of what normal looks like for you. So when something changes, it flags it, not as a diagnosis, but as a signal. This matters because many diseases don't start with pain. They start with quiet, visual clues. The upside is early awareness. The downside? Knowing something might be wrong without certainty. Blood tests aren't going away, but the way we do them is changing fast. New at-home diagnostics use finger prick blood samples, saliva and breath analysis, wearable patches that sample fluids through the skin. These tools can already measure things like glucose, inflammation markers, hormones, and metabolic health, things that used to require full lab visits. Instead of waiting weeks for results, people can test more frequently and spot changes earlier. Hospitals won't disappear, but they'll handle complex cases. Routine monitoring is shifting into kitchens, bathrooms, and bedrooms. Healthcare becomes less about single snapshots and more about continuous trends. This is where things get both exciting and unsettling. AI doesn't think in symptom, it thinks in patterns. A single data point means nothing, but thousands of data points over time, that's where AI shines. Small changes in sleep, heart rate, bathroom data, facial features, and activity levels can form patterns that match early stages of diseases like diabetes, heart disease, or even certain cancers. In some cases, AI can flag risk years before a human doctor would ever notice. But here's the catch. Being at risk isn't the same as being sick. Early prediction creates a new psychological burden, living with warnings instead of diagnoses. This is the part most companies don't talk about. When you monitor everything, You find everything, including things that may never harm you. False positives can trigger anxiety, unnecessary follow up tests, and even treatments that cause more damage than the problem itself. Overdiagnosis is already a major issue in modern medicine, and constant monitoring could make it worse. There's also the mental cost of always feeling watched by your own health data. Early detection saves lives, but only when used carefully. The future of at-home diagnostics isn't just a technology problem, it's a human one. Here's the real question. If your bathroom knows everything about your health, who else knows? Tech companies, insurance providers, employers, governments? Health data is the most valuable data there is, and the fight over ownership has already started. Doctors aren't disappearing, but their role is changing. AI will monitor and detect. Doctors will interpret, decide, and care. Healthcare becomes less about finding problems and more about what to do once a problem appears. Human judgment still matters, maybe more than ever. In the next 5 to 10 years, your home becomes your first doctor. Hospitals become specialists, not gatekeepers. Health monitoring becomes constant, invisible, and personal. The future of healthcare isn't a building, it's your home, and it's closer than you think. Explain how at-home health tech is making advanced diagnostics cheaper and more accessible. Compare traditional lab costs with new at-home device pricing. Talk about subscription models versus one-time purchases. Mention how insurance companies are beginning to cover some at-home diagnostics, why it matters. More people being able to afford regular health insights could change preventative care on a global scale. Discuss how continuous data from at-home devices creates a personalized health profile. I can learn what's normal for each person. It can alert you to changes before noticeable symptoms appear. People can adjust lifestyle habits, sleep, diet, exercise, based on real feedback, not guesswork. Why it matters. This shifts healthcare from reactive, fix after problem, to proactive, prevent before problem. Technology that collects health data raises serious questions about who owns and uses your information. Data shared with tech companies, insurers, employers, risk of breaches or misuse, need for strong privacy laws and transparent policies. Why it matters. Without clear safeguards, people may be monitored more than they think, even outside healthcare. Explore what comes after at-home diagnostics, connected cities, public health, and global health networks, communities using aggregated data to detect outbreaks faster, urban planning based on real health trends, air quality sensors, disease tracking, health ecosystems where home, clinic, and public health systems are integrated. Why it matters. Health tech won't stop at your bathroom. It could reshape whole societies. If this future excites you or scares you, you're not alone. Subscribe for more breakdowns of the tech quietly changing your health, your data, and your life. Because the biggest health revolution won't feel like a revolution at all.